Okay, I'm going to clean up after our surgery. First thing I'm going to do is turn off our lights. Get those out of the way. And I'm going to collect all of our instruments to be washed. Take any leftover suture material and trash and throw it in the trash. The sharps were already removed by our doctor. We've got them well trained. Put the surgical drapes in with our surgical laundry so they can be washed separate. I'm going to leave these over here to be cleaned in just a moment. Walk into the next. This, and there's the towel in the regular laundry. I'm just going to take our trash out, so it's out of the way. So I can clean the cord. And I'm going to set all the other cords out so I can clean these also and wrap them properly. When I come around, I'm also going to turn off the heater of the table so it's not on. Oh, where's the table? There you go. Righty tighty, lefty loosey, you know. Okay, I've got everything disconnected. I'm going to spray everything down with my cleaning agent, which we use A-Cell. I'm going to let it sit and soak for about 10 minutes. Go ahead and spray down the legs of anything in here also. Spritz these down so when I'm cleaning them, I've got a good coverage. Now I'm going to just let that sit for a few minutes and come back and clean everything up. I'm going to take the ambu bag off of the machine so it can be cleaned, and also the rebreathe tubes. I'm going to check the levels of our ISO, and it could use a little touch up, so I'm going to fill that up also. And I'm going to take out. I'm also just going to make sure everything was turned off when we unhooked the animal from the machine. So our oxygen is off, and so is our ISO vaporizer, and everything else looks good there. Okay, now I'm just going to wipe down everything that I've already sprayed down, and then when I'm done wiping everything down, I am going to come through with a broom and a mop and clean everything out. £130 masses. Okay, now I'm just going to come through with the broom and the surgical mop, and we're... Okay, I'm going to show how to clean some instruments, and we use an enzyme instrument cleaner, and we use about 16 ounces, which is 2 pumps of this in some fresh, warm water. Anything that opens, we open and set it into the cleaning mixture in the bucket. And then I usually just kind of move it around a little bit, let it sit for a few minutes and get any of the debris off. Once they have sat for a little while, take a brush and scrub the edges, get into the joints of any opening that may be there on both sides of the instrument, down into the handle. The same on the other side, and open it all the way to make sure I get all the way on the joint. And I usually stick it back into the cleaning solution just to make sure it's nice and disinfected on that side. And then once you're done there, gently rinse off the instruments. And then in the sonic cleanser, drop them in opened. Replace the lid. And turn it on for about 15 minutes. That have already been ran. Go into the milk bath, and it just helps keep all of our metal instruments from rusting. And that goes in for probably about 15 minutes. This runs for about 15 minutes. And when all of that is done, you set out the instruments to dry. And when they're dry, they get transferred over to the other side where they get a little more dry time if needed. And then we wrap the pack. All right, now that the instruments have sat in the milk solution for 15 minutes, I'm going to go ahead and pull them out to dry. I just let them drip nicely, get any excess moisture that I can off, and lay them flat on the towel to dry off. Okay, Now those are going to dry. Once those are fully dry, they can be wrapped and sterilized in the autoclave. And that's the cleaning of the instruments. Okay, next I'm going to rewrap a neuter pack. And within the neuter pack, it has 4 hand towels for draping, 1 number 3 scalpel blade handle, 1 thumb tissue forceps, 1 Metzenbaum dissecting scissors, 1 sharp blunt operating scissors, 1 Olsten Heger needle holder, 1 Halstead mosquito forceps, and 2 curved tip hemostatic forceps, and 2 straight tip Kelly forceps. Also, there will be 2 small stacks of gauze, which are already counted out. I do 20 and 20 in both stacks. And then the strip, which goes into, the indicator strip, which goes into the pack as well. All right. All right, so we got all of our hemostats. So there's all of our hemostats. And set them as organized as you can into, the tray. And then we have the needle holders, the straight blunt, sorry, mixing those up. And you want the needle holders towards the top. Stack those in there. The tissue forceps. Stick those in there. The number 3 scalpel blade tucked into the side out of the way. And 20 and 20. Stack those on there. Oops. And then I've got my pre-folded towels over here. Two and 2. And then the tissue or the towel clamps on top. I'm going to set this off to the side and move my pack. So bring the corners up. It's probably not going to be pretty because I'm not too graceful at the wrapping. tuck it enough where you can pull the tab. And then after that part, grab the outer wrap. And the indicator strip. And the reason why we use the indicator strip is because this little strip in here will change colors when the pack has been autoclaved and it is officially sterile. So that's a very important piece not to miss. Then as I almost miss it. Try to tuck the corners so there's not a bunch of excess out. Definitely won't be hired to wrap any Christmas presents anytime soon. You want to leave enough of a tab that they can easily grab it without having to reach into the pack to pull it. And then the indicator tape, which goes over the top and also lets you know that the pack has been autoclaved because it has these little lines that will change color and get darker. And then my Sharpie, which ran away. Date it. Date it, write what kind of pack it is, and the person who wraps initials. This can now be autoclaved. Okay, next I'm going to show how to properly fold and wrap a surgical gown. So the first thing you do is place the side with the whole armholes down onto your table. And then this drape is a waterproof drape, so it's a little bit slipperier than a normal one. Then you fold the arms in. And then you bring up the outside of the drape and fold that in as well. Making sure to pull any of these strings up onto the gown so that they're not hanging out. And the purpose behind that is so when the surgeon or the tech that's scrubbing in don't have strings hanging down that if they grab, it accidentally pulls the whole thing off the wrap as they're opening it. Okay, next, grab the neck and flip. Then you fold in half. And actually fold a little bit smaller so that it fits into the pack a little bit better. And I make sure that the sleeves are easily accessed so that when they do open the gown, they can slide their hands in and lift and put their arms through. Make sure those strings are tucked in. And the next thing you do is do an accordion style fold. Loosen all your strings and keeping everything tight. Oops. My strings are hanging out, so I'm trying to find them all. So when you're done, you want to be able to see the sleeves out here so that when they open the gown, after they've unwrapped it, you can grab the inside, slide their hands in, and open it. Okay, all my strings are tucked. Next, grab the wrap. And you want to kind of wrap it tight because the gowns, since they're looser, they easily come undone. Just discovered the hard way. Oops. So now I've got my pull tab at the top. And then next I put my 2 towels on top so that when they're done washing their hands and they open up the pack, they have the 2 towels. And again, just in case one falls. Got the indicator strip, put it on top of the 2 towels. And the final wrap. Smooth it out, make it easier. And then tuck it enough so there's just a little bit of a tongue sticking out so it's easy to grab. Then your indicator tape. Look at that inch. Just place that over the top. And then you write the date, what it was that you wrapped, the size, and the person who wraps initials, and this is now ready to be autoclaved. Next, I'm going to demonstrate how to use an autoclave. Our autoclave here is pretty easy. It's just push a couple of buttons. It's already preset, and it'll tell you when it's done drying at the end. I
idea behind the autoclave is that it heats to a certain temperature in order to disinfect the instruments. And the temperature that we use for packs, which is what I'm about to put in here, is 250 degrees at 15 psi. And what it does is it penetrates the packs with steam. And the steam gets in fully into the pack and it disinfects everything by the heat. So the first thing I'm going to do is open it up, make sure there's nothing already sitting in here on the shelf. Place my nicely wrapped pack. Make sure it's not touching the edges or the top. There's nothing else in there. Make sure it's tightly shut because you don't want that steam coming out and burning you if you're walking past it. All right, and then the next thing that you do is select the cycle. So I'm going to select packs. And it'll tell you everything. It takes about 30 minutes to dry, which is a good time frame to go for. And then you just hit start. It'll tell you it's filling the chamber, so it fills the chamber with water, which is what makes the steam. Once that's done filling, it'll also preheat, and then when it's done preheating, it'll steam the pack. And when it's done, it'll tell me when it's done steaming it. It'll release the vent. It makes a very loud noise. Pop the door open, and then you wait until it's done beeping, and it'll let you know when it's safe to touch anything that's inside. But it's good to leave it in there for 30 minutes to cool off and dry. And that's how you use an autoclave. With the autoclave, it's important to do weekly and monthly maintenances. With the weekly maintenance, it involves cleaning the trays and also the chamber of the actual autoclave. And you use distilled water when you do that because you don't want any harsh chemicals or anything that's going to break down the instruments after it's been cleaned. You don't want any crazy chemicals in there. And then you can use mild soap as well. There's also a special agent called Speed Clean, which helps clean the autoclave. And then monthly, you clean the chamber and the plumbing, and you also would do a pressure relief valve check and run the autoclave without anything in it, clean the filters, and all of that good stuff. Make sure everything is in working order. There is a seal that needs to be ensured that that is working so no steam is escaping and there's nothing coming in while you're autoclaving. That's it. Another important part of maintaining the autoclave is adding distilled water. For the autoclave to work for the steam, you only use distilled water. And there is a reservoir in the machine that you fill that up to.